Okay, oncology now. General information. Alcohol plus tobacco are co-carcinogenic. Y'all, you're going to see as we go through this section that there are several different cancers that if you have alcohol and smoking in the presence of each other, that just makes everything a lot worse. It makes cancer develop a lot more rapidly. So that's why we say they're co-carcinogenic. Tobacco is the #1 cause of preventable cancer. I think we already know that. Suspected dietary causes of cancer. Well, a low-fiber diet, for one thing. You see, with a low-fiber diet, you don't have as much motility in your intestines, so therefore you're retaining carcinogens longer. That's why they want us all to be on a high-fiber diet, all right? We're going to talk more about that in just a little bit. Increased red meat consumption, increased animal fat, nitrites like in sandwich meat, processed sandwich meat. There's alcohol again, and then preservatives and additives. You know, really the big push is to eat all natural foods, whole grain foods, things like that with no preservatives, organically grown, that sort of thing is the very best. Now, there's an increased incidence of cancer in the immunosuppressed. That is why there's a higher incidence of cancer if you're greater than 60. You know, the older you get, the poorer your immune system is, right? Okay. Now, let me talk about the immune system. You know, right now in our body, all of us have cancer cells right now. But we have a good immune system, so what is our immune system able to do? Recognize those cancer cells and destroy them. However, when you become immunosuppressed in any way, then your immune system can't fight those cancer cells as well. That's why eating healthy is also very important for building up your immune system, too. Now, the most important risk factor for cancer is aging. It's just the fact of life. The older you get, the greater the chance it is that you're going to get cancer, simply because you've had cells in your body for so much longer, and there's mutations that can occur, and DNA can get messed up, and then cancer can expose itself. But also, you got to remember that the older you are, the longer you've been exposed to environmental toxins too. So your risk for cancer increased. Cruciferous vegetables such as broccoli, cauliflower, cabbage are very good. Vitamin A foods, that's just the way I remember vitamin A foods, is anything with color to it, whether it's squash or a red bell pepper or something like that. That's a colored vitamin A food. Carrots. And vitamin C could decrease risk. African Americans have a greater incidence than Caucasians. On that, they don't really know why. There's no specific factor that tells what the etiology is behind that. Primary prevention, that's a term we hear used a lot when you're studying cancer. These are ways to prevent the actual occurrence of cancer, like using sunscreen and just never smoking. And then we have secondary prevention, and that's when we use screenings to pick up on cancer early when there is a greater chance for cure or control. Now, chronic irritation brings about uncontrolled growth of abnormal cells. Irritation. For instance, if you have a mole in a spot that is constantly being rubbed by clothing, that's irritation. Smoking is an irritation to your lungs. So there's lots of things out there that can cause irritation. Chronic reflux, somebody that always has trouble with gastroesophageal reflux disease is at a higher risk for esophageal cancer because that's irritation. Now, let's look at some prevention things here. First of all, the female monthly self-breast exam. Everybody knows how important that is. Once a female starts their period, they should be taught to start doing the monthly self-breast exam. Now, on what days of the menstrual cycle is the best time for doing the self-breast exam? Ask your friend. Day 7 through 12. Anytime through day 7 through 12. The key is this: after the period is just about over with, you would never want to do the self-breast exam prior to the period because that's when you're going to have a lot of swelling and tenderness, and they're not going to get a good exam that way. So it's after the period is really just about over, anytime between days 7 through 12. Now, if you've got somebody who's postmenopausal or has had a hysterectomy, of course they're not having a period. So what you do is you teach them just to remember a certain day. Like, what's your birthday? Okay, it's February the 17th. Okay, the 17th of every month, you need to remember to do a self-breast exam. All right. Also, yearly clinical breast exam for women greater than 40 years of age and between 29 and 30 needed every 3 years. Now, when I say a clinical breast exam, I mean in a doctor's office setting, okay? Annual pelvic exam is needed, and a pap smear is really only needed every 3 years if there's been no problem, according to the American Cancer Society. But most of the time we get those yearly anyway because you're going to the doctor having your yearly pelvic exam and that sort of thing, so they just go ahead and do the pap smear anyway. Now, there are 2 things you should instruct your patient not to do prior to having a pap smear. Ask your friend what those 2 things are. I heard somebody say it. No douching, first of all. A lot of people are like, oh, I've got to have a douche before I go to the doctor. No, that messes up the cervical cells. The only time that someone should use a douche is when it's been medically prescribed, okay? That messes up the cervical cells. And also, no sex prior to a pap smear. Y'all, you don't want other things on the little slide. Now, do you? Ask your friend, okay? Anyway, okay. Mammogram, baseline at 35 to 40, yearly after 40 with 2 views of each breast. Okay, now before a mammogram, what should you tell the patient not to have on their body? Ask your friend. No lotion, no powder, no deodorant. No lotion, no powder, no deodorant. You see, when you have lotion or powder or deodorant on, that could be picked up on the mammogram as a calcium deposit. It looks like a calcium deposit, and most of the time when we see a report where the patient has a calcium deposit, that usually means cancer. So see, that would alter the test. Now here's the deal though. Most women have not been told that prior to going to get their mammogram. So the first thing they always do when they get there is they give them a washcloth and they tell them to bathe off really, really well to make sure they get all the lotion and deodorant or powder or whatever they have on off of the body. And then a yearly colonoscopy at age 50, then every 10 years after that, if there's been no problem. Now, the more problems you have, the more frequent you have to have those sorts of things. All right. Now, for the male, they also need to do the monthly self-breast exam. Same type of procedure is going to be done. And then a monthly testicular exam. Now, monthly because testicular tumors grow very fast. Now, the major age group that gets testicular cancer is between 15 and 36, so young males. This is something that needs to be taught early on, and it needs to be done. Be sure and teach the patient to do that monthly because testicular tumors do grow so fast. Yearly digital rectal exam and yearly PSA for men over the age of 50. We're going to talk more about that later. And then a yearly colonoscopy at age 50 and then every 10 years. Now, caution. I'm not going to read all of those to you. You know what those are. Those are warning signs is what they are that need further investigation. If somebody has any of those things need further investigation. Cancer can invade the bone marrow, which can lead to anemia and thrombocytopenia. So if you ever got an anemia question, you know you're just really focused